I'll be brief because there's a lot of repetition here. Just want to say that this subregistry was actually initiated by the ESPN with the non-restricted grants from Advisen, and it was supported on the web page of the ERKNet registry. It has a structure. We have two chairs, which are currently Elena Levchenko and Detlef Bokenauer. And then in the steering committee, we have Dieter, Franz, Rosa Vargas, Hemari Seta, and myself. And obviously, this is also a part of the ERKNet tubulopathy group activities. So the objectives are to capture data on presentation, treatment, and long-term outcome in distal RTA. And this will be used to assess the impact of treatment on long-term outcome. And that includes growth in children, eGFR in all patients, and to establish criteria for adequate treatment and monitoring. And we have a commitment of producing publication at least every 5 years, as this is a longitudinal registry. The inclusion criteria, I'll be very brief, are clinical diagnosis of distal RTA, and we're including both primary inherited and secondary acquired form. The latter are particularly important for adult patients. And the data collection are similar to the one that you've heard before. We're collecting basic data, medication data, and visit data. And the capture forms are split into the initial visit and the follow-up visit. And I'll shortly show them to you in a moment. So you're familiar with this now this web page where you can log in. You can have information on the distal registry. Let me just take a pointer here. You'll find here the information that I just showed you on the registry. And then you can, I just took here some of our patients with distal RTA to show you an example. So you select the registry, you have the initial data that includes the informed consent form, basic demographic data, some simple data on your center, and then we have questions that are extremely simple on the diagnosis. These are data on the diagnosis, data on the genetics, on how the genetics has been performed, on what the results of the genetics are. And that includes, if you can, please insert it, the sequence code, because when we then analyze these genetic data, knowing the gene, the sequence, the reference sequence is actually very useful to categorize these mutations. And then you have patients' visit data, and these are very, very quick. Basically, height, weight, and blood pressure, a few symptoms that are listed, and by default, these are listed into no, and then some basic results, eGFR, bicarbonate level, and electrolytes. Basically, that's about it. And in the urine, we're particularly interested, obviously, in the calcium and creatinine. And please here, it's very important to use the correct units because this is one of the issues that we're having when we are now performing the first interim analysis. You will also be asked whether an ultrasound has been done, and if such, to list whether there are renal cysts, renal stones, and medullary nephrocalcinosis. And then the last part is basically on treatment, which is the most striking aspect because most of these patients receive very different forms of alkali supplementation. And the one thing to remember is that we do ask the dose per day. So this should be the sum of all the doses that the patient has received during the day. And this has been an issue. And also, it is difficult because there is many formulation of citrates that can be on potassium salt or sodium salt. They can be mono, B, or tripotassium citrate. We're trying our best to translate this into alkali equivalent. When there is the brand name, it's the easiest thing because we can go on in the internet and calculate how many alkali equivalent that is. But if not, we may have to go back to you. And here is complete, because this is a slide that was made last year, but I think most of you that have contributed are listed. If not, please forgive me. We will make sure that you are all listed once the interim result is produced. Thank you.